Welcome to the deep dive. Today we're getting into something pretty fascinating, how mother dogs and cats care for their young. It seems like it should be pure instinct, right?
You'd think so. But yeah, the sources we looked at show it's actually, well, a lot more complicated, sometimes baffling even.
Totally. We think of that devoted mother image, but it doesn't always happen like that.
Exactly. Yeah. Our sources highlight times when that nurturing drive either goes way overboard when there aren't any babies or sadly kind of falls short when they really need it.
Right. And the sources split this into two main things, yeah. Excessive maternal behavior, even with no offspring, like phantom pregnancies.
Mm-hmm.
And then the other side, deficient maternal behavior, not enough care when there are pups or kittens.
And interestingly, the sources suggest that lack of care might be a bit more common in dogs.
While the excessive stuff, the empty nest behaviors, may be more in cats.
It seems that way, yeah.
Okay, so our mission today in this deep dive is to really unpack all of this.
Right. We want to understand the different ways these behaviors show up, explore what might be causing them according to the sources, and just get a better handle on this side of pet ownership that maybe isn't talked about enough.
Okay, let's start with getting clear on what these abnormal behaviors actually look like. So deficient maternal behavior, what are we talking about specifically?
Well, deficient behavior is basically a spectrum of not enough care. At the extreme end, it's total abandonment. The mother just leaves the newborns.
Wow.
And the source notes this can be more likely sometimes after a C-section.
Okay.
Then there's what's called poor maternal behavior. So the mother might stick around, physically be there, but she just won't let the pups or kittens nurse.
Which is obviously critical for them.
Absolutely vital.
Yeah. Are there other ways this lack of care manifests?
Yeah, the sources also mention inadequate retrieval. If a little one wanders off.
She doesn't bring it back.
Exactly. Doesn't bring it back. Or not enough cleaning. And that's not just about being tidy.
Right. The licking is important.
Super important. It stimulates circulation, helps with breathing, and crucially, the mother's licking also stimulates urination and defecation in the very young ones. They can't do it themselves initially.
Ah, okay. Didn't realize it was that critical.
It really is. And some mothers might fail to do that. We also see moms who constantly carry their babies around but never really settle them down properly.
Huh.
And then in the really, really sad cases, you can actually see mothers harming or even killing their own litter.
Gosh, that's awful to think about. Okay, let's flip that. What about the excessive side?
Right.
When the instinct goes into overdrive without any actual babies.
Right, so this is where that nurturing drive gets kind of misdirected. In female dogs that aren't spayed, or maybe spayed just after a heat cycle, you can get pseudocyesis, false pregnancy.
Okay.
And they might, adopt things, a squeaky toy, a slipper, or whatever, and treat it like it's a real puppy.
Seriously?
Oh, yeah. They'll guard it, try to nurse it, make a nest for it. They can even get physical signs like enlarged mammary glands, maybe even produce a bit of milk. And in cats, if a female is spayed soon after she's had kittens, she might actually try to steal kittens from another nursing mother.
Whoa. Okay.
Yeah. And even a spayed queen. If orphan kittens start trying to suckle on her, she might actually start lactating.
Mm-hmm.
It's pretty remarkable biologically.
It really is. Kind of unsettling how strong those urges are, even when the trigger isn't, real.
Definitely.
Now, the sources also mention maternal aggression. That sounds like a big worry for owners.
It can be, yeah. It's important to distinguish here, though. Aggression towards other animals in the house, especially dogs, is actually pretty common for mother cats with kittens. It's that protective instinct, right?
Makes sense.
In dogs, aggression towards people is less common, but it can happen. Towards familiar people, even strangers.
Okay.
And the source specifically flags a possible link to hypocalcemia, low calcium levels.
Ah.
We also need to be careful not to confuse really vigorous licking of the newborns, which could maybe accidentally hurt them in a rare case, with actual intentional aggression.
Got it.
And sometimes a mother might reject or attack an offspring if something changes dramatically about them, like their smell, if a human handles them too much, maybe. Or if she feels really stressed or threatened, maybe other dogs around, too much commotion near the nest, she might redirect that stress onto the pups or kittens.
Okay, so a whole range of stuff. Not enough care, too much misdirected care, even aggression. What do the sources say is driving all this? Is it all just hormones?
Hormones are definitely a big factor in some cases, like with the pseudocyesis in dogs. That classic pattern of progesterone rising and then falling seems to trick the body into thinking it's pregnant.
Right.
And the source also suggests that after a C-section, Maybe that normal surge and drop of hormones like oxytocin, which is so important for bonding and recognizing the babies,
Yeah.
that process might get disrupted.
Yeah.
And that could be why some mothers refuse to accept their puppies post-surgery.
Okay, that makes sense.
But, and this is important, the source also points out that for many of the other deficient maternal behaviors, the underlying causes, we actually still don't really know. The pathophysiology is often unknown.
Huh. So there's still a lot to figure out there.
Definitely.
What about genetics? Is there any hint that this stuff could be inherited?
That's a really interesting angle the source brings up. While there isn't like a specific bad mother gene identified in dogs and cats, there is a noted breed predisposition for deficient maternal behavior in Jack Russell Terriers and Cocker Spaniels.
Oh, interesting.
Which, strongly suggests there's some genetic component involved. And even more intriguing, the source mentions research in mice.
Mice, okay.
Where genes linked to poor mothering seem to be paternally imprinted.
Paternally imprinted. Okay, wait. Break that down. What does that actually mean?
So basically, if this works the same way in dogs and cats, and that's still a big if needing research,
right,
it could mean that a mother who rejects her own babies might have actually had a great mom herself. But the tendency, the genetic instruction for poor mothering could have come from her father, and maybe her grandmother, the father's mother, was the one with the issues.
So it's like the gene only gets switched on if it comes down the dad's side, even if the mom inherited a good mothering gene from her own mother.
Kind of like that, yeah. Like a specific set of instructions that only gets read if it's from the paternal line. But again, the source is careful to say this needs way more investigation in dogs and cats specifically.
Wow, that's fascinating and a bit mind-bending. Okay, so beyond hormones and potential genetics, what other risk factors did the sources mention?
Yeah, there are several. For deficient behavior, first-time moms seem to be at higher risk.
Okay. Makes sense, maybe.
Older female dogs, too.
Yeah.
And, as we mentioned, having had a C-section.
Right.
For the excessive behaviors, like kitten stealing, just having kittens nearby a recently spayed cat is a big trigger.
Gotcha. Proximity is key there.
Exactly. And in the environment, lots of disruption, other dogs, too many people milling around the nest area.
Yeah.
That can increase the chances of that excessive carrying or redirected aggression or even, sadly, cannibalism.
Okay.
And finally, just having a really large litter, or if some of the pups or kittens are sick or weak, that can also stress the mother and potentially lead to abnormal behaviors.
It really sounds like a lot of things can potentially disrupt this whole system. So if an owner thinks, uh-oh, something's not right here, how does a vet figure out what's going on? What else could it be?
Well, the absolute first step for the vet is to figure out, is this abnormal behavior the main problem, or is that happening because of something else medical?
Okay, like what?
The source specifically mentions mastitis. That's an infection in the mammary glands.
Right. Painful.
Very. And metritis, which is a uterine infection. Both of those can definitely make a mother unwilling or unable to care for her young.
Makes sense. Anything else?
There's also lactation tetany. That's from low calcium. It can cause aggression.
Ah, the calcium link again?
Yeah, but typically that happens a bit later in lactation.
Yeah.
And the aggression isn't usually aimed at the newborns right away.
Okay.
So routine blood tests and urine tests, they're usually normal unless one of these other things is going on, like the low calcium. So diagnosis is really about careful observation plus ruling out those underlying medical issues.
Got it. So it's a process of elimination sometimes. What about actually doing something? What are the treatment or management options?
Okay, so for the deficient or poor maternal behavior, the number one thing is creating a super quiet, dark, calm, isolated space for mom and babies.
Minimize stress.
Exactly. If a mother is actually biting her pups, she might unfortunately need to wear a muzzle to keep them safe.
Oh, wow.
And if that's the case, or if she's just not stimulating them, the owner has to step in and, manually stimulate the newborns to urinate and defecate using a warm cloth or something.
Right, taking over that essential function.
Precisely. In cats that might be showing cannibalistic signs, sometimes an Elizabethan collar, the cone can help prevent that. But it's tough news owners need to note that these deficient behaviors can often repeat in future litters. So rebreeding is generally not a good idea.
That's important advice. Any medications?
Sometimes oxytocin might be tried. And maybe in some specific situations, asastapromazine, it's a dopamine blocker. The idea being to maybe boost prolactin levels, which helps with milk and mothering behavior.
Okay.
But honestly, the most crucial thing is daily, close monitoring of the offspring. weighing them every day to make absolutely sure they're gaining weight and getting enough nutrition.
Right. Tracking their progress is key. What about the other side, the excessive stuff? Phantom pregnancies, kitten stealing.
Yeah, so if a cat has stolen kittens, you need to separate her immediately from the stolen kittens and from their actual mum. Give the real mum her space back.
Makes sense.
For dogs with false pregnancies who are mothering objects, step one is just take the objects away.
Oh.
You might also need to restrict her food intake a bit. Helps discourage milk production. And if she's not spayed yet, the advice is usually to wait a few months after her heat cycle ends before spaying her, because doing it right after can sometimes trigger these behaviors.
Ah, timing matters for the stay.
It can, yeah. And obviously, spaying ultimately prevents future phantom pregnancies. There are medications too, like mybelorone, bromocriptine, cabergoline. They mostly work by inhibiting prolactin.
Okay.
But, some might be hard to get or have side effects, so that's definitely a vet conversation. And for straight-up maternal aggression, separating the kittens is usually the safest and best bet. Just weaning them might not be enough to stop the aggression sometimes.
It really sounds like the approach needs to be tailored case by case. What about preventing this stuff in the first place? Anything owners or breeders can do?
Well, the biggest preventative measure the source emphasizes is just providing that really quiet, comfy, undisturbed place for any pregnant or nursing female, away from other pets, away from lots of foot traffic.
Setting them up for success, basically.
Exactly. And like we said, if a female has shown poor maternal behavior before, probably best not to rebreed her. And maybe keep that potential paternal gene thing in the back of your mind when making breeding choices.
Right, considering the history. So what happens if things go wrong? What are the potential complications? And what's the usual outlook?
Well, the most obvious and heartbreaking risk is losing the puppies or kittens. Neglect, aggression, lack of warmth or food.
Yeah.
It can be fatal.
Yeah.
The source also brings up an interesting point. Animals that have to be hand-reared, because their mother couldn't care for them, they miss out on that natural suckling and maternal licking.
Mm-hmm.
And sometimes that can lead to them developing abnormal social behaviors later on, issues with handling stress, even problems with their own reproductive behavior down the line.
Wow, so it has long-term effects potentially.
It can. Now, for the excessive maternal behavior, the good news is it usually clears up around the normal weaning time, 6 to 8 weeks. But the poor or deficient behavior, as we've said, that unfortunately has a tendency to happen again in future litters.
This has been really, really interesting. And yeah, quite sobering in parts. It just makes it so clear that maternal behavior isn't just this automatic switch.
Not at all.
It's this really complex mix of hormones, maybe genetics, the environment, and these problems, these deviations, are maybe more common and varied than we tend to think.
Absolutely. And I think the information we've gone through today really shows how vital it is for owners to just be observant. And to get veterinary help if they see something concerning. Understanding what might be going on is so key to helping both the mother and her babies.
Yeah. And that kind of brings us to our final thought for you, the listener, to chew on. Thinking about that potential genetic link, especially that really intriguing idea about paternally imprinted genes, it does make you wonder about the ethics and the long-term view when it comes to breeding decisions, doesn't it? Especially if there's a known history of these kinds of maternal issues in a line. Just shows there's always more layers to understanding animal behavior. Anyway, thanks for joining us for this deep dive.